All right, today we're going to get started on the Gallatin County COVID-19 press call. We have Lori Christenson, who's the Gallatin City County Health Officer. We also have Kallie Kujawa, the Bozeman Health COVID-19 Incident Command Lead. Unfortunately, Michael Becker and Tracy Ellig were not able to join us today, but if anyone has questions for the university, they can get in touch with Michael later on today, and they hope to join us next time. So I'll turn it over to Lori.
Great, thank you, Holly. I appreciate it. Again, my name is Lori Christenson, Gallatin City County Health Department Health Officer, and I'm going to go ahead and start with a brief update for local epidemiology, starting with, not that one. Sorry. Starting with our surveillance report. So this is, again, our surveillance report for the week of November 19th. Figure 1 describes the number of daily cases on a 7-day rolling average of cases per 100,000 residents. And we're looking here at the end of this figure here, where you're starting to see a little bit of a plateau, which is good. We want to continue to see this and also see continued declining cases. So we saw about a 17% decrease from our previous week, which is good. So we want to continue to see this trend. The same trend is holding for our daily and 7-day average percent positive. We are seeing a little bit of a decrease where we're just above 10% positivity rate. We're right around 11.3 as of 11/16. So again, that's all the way down here in the far end of our figure here. Again, the red line indicates the 10% positivity rate, and we want this to drop below the 10% positivity rate. So we'll continue to watch that. We are liking this decrease that we're seeing here. We're still seeing a median turnaround to public health for specimens collected within 1 day. Again, that's really important for us to be able to quickly and easily identify cases, to isolate, and then also help identify those close contacts. So this quick turnaround time is really important for us. In terms of our number of cases among those who are vaccinated versus unvaccinated, again, the orange bar indicates individuals who are not vaccinated. Blue bar here indicates individuals who are fully vaccinated. And as you can see, we continue to see that most of our cases are among those who are unvaccinated. We've seen a decline in the number of hospitalizations, and I think Kallie may speak a little bit to this as well. But we, again, see that most of the cases in our community or among Gallatin County residents who are hospitalized are among those who are unvaccinated. Again, that's the orange bar here. Some information about our first doses. We continue to see an increase in individuals who are receiving a first dose. Again, the bold, kind of darker numbers here indicate a 1% increase. So we continue to see individuals seeking a first dose, which we really like to see. We want to continue to see that. And then in terms of our fully vaccinated residents, excuse me, we didn't see a 1% increase in any of these age groups, but again, we are seeing individuals who are coming in for first and second doses, and we want to continue to see that. One thing I do want to note is on our figure here, we do not include the vaccine data that we received from DPHHS, that we make these figures from, did not include the 5 to 11-year-olds. However, I can share the state's, I'll share it with you in just a second, but the state report that kind of has that breakdown for you. So I'll share that with you, and we'll hope that we'll be able to provide a little bit more of a breakdown for you in the coming weeks. So I'll share that in a second, but I do want to also just share that it does look like some of our school cases are starting to tone down a little bit. We hope that that continues. But as you know, we're heading into a pretty busy holiday season and a lot of indoor activities and a lot of travel. So we hope that this trend continues. That said, it really depends on the community being really diligent about washing their hands, staying home when they're sick, continuing to seek vaccination, and just safely gather with others in our families. The last thing that I wanted to share in terms of our transmission, our community still is considered to be in high transmission, which means we should be wearing our masks indoors, whether we are vaccinated or not. We are about 3 times higher than the CDC threshold at this point in time for what would be considered high transmission. So with that, I will stop sharing. I'll just quickly share that other screen. I can figure that out. Oh, I think I closed it. So, oh, no, I didn't. Okay, great. Sorry. Thanks everyone for bearing with me here. Okay, here we go. And these data are available on the Montana DPHHS site. And I just wanted to point out here in our 5 to 11-year-olds, it's indicating we have about 7% who have received a first dose. And again, so this is not unusual that we're going to see some individuals. This percentage hopefully is going to continue to kind of tick off towards this way as these other age groups have. We obviously don't have any that are considered fully vaccinated at this point. So this is just indicating those first doses. All right, so with that, I'm going to turn it over to Kallie.
Great, thanks so much, Lori. For those of you I don't know yet, I'm Kallie Kujawa. I'm Bozeman Health System Director of Quality and Safety, and I'm our Incident Command Lead. Today, we currently have 20 COVID-19 positive patients at Deaconess Hospital. We have no COVID-19 positive patients hospitalized at Big Sky Medical Center. Our critical care unit at Deaconess Hospital has 20 beds and is currently at 95% capacity. 7 of the 19 in our CCU are COVID-19 positive, with the remainder being other healthcare needs. So although our COVID positive hospitalized patients are decreasing, we still have pretty high census throughout our Deaconess Hospital. Additionally, our medical unit is at 97% capacity, and our surgical unit is at 121% capacity. I'd like to start today with sharing information on the Centers for Medicare and Medicaid Services condition of participation on the COVID-19 vaccine requirement. Bozeman Health is required by the new Medicare condition of participation to have all employees and providers fully vaccinated by January 4th, 2022. As a Medicare provider and in accordance with our mission and our focus on patient and employee safety, we will comply with this requirement. Employees and providers who are not yet vaccinated must get their first dose of a COVID-19 vaccine by December 6th, 2021, and the second dose by January 4th, 2022 actually. Individuals may submit a request for a medical exemption and or a religious exemption. We recognize the complexities with House Bill 702. However, until there is further direction from the courts, the CMS rule remains in effect and we will proceed accordingly. We understand that this evokes a multitude of thoughts and feelings, and we want to emphasize that it is our desire to keep all of our staff employed here at Bozeman Health. Currently, approximately 80% of employees and 90% of medical staff providers are vaccinated. We value all of our employees and providers and appreciate the high quality care they provide to each patient. I'm pleased to share, switching gears a little bit, that our joint vaccine clinic with Gallatin City County Health Department continues to go very well. We continue to offer COVID-19 vaccine to all individuals over the age of 5. And to date, we have administered over 805 Pfizer vaccines to those between the ages of 5 and 11. And that includes both first and second doses. It's very exciting that we are now starting to offer second doses to that age range as well. Yesterday, the FDA authorized Pfizer and Moderna boosters for adults. Booster or third doses are available for all adults over the age of 18 at Deaconess Hospital and at Big Sky Medical Center. You can go to our website to get more information about the appointments that are available or the times that you can receive your any one of your first, second, or third doses. But that's all I really have for today. I'm happy to answer questions. Thanks, Lori.
Great, thanks, Kallie, for that update. I appreciate it. Okay, are there questions for either Kallie or I?
Hi, Lori. I have a question. This is Annie Johnson with KBZK.
Hi, Annie.
Can you hear me?
We can hear you.
Okay, perfect. My first question to you is, do you have a comparison from this time last year as far as where numbers were? And I'm saying that in regards to Thanksgiving. I know we're seeing a plateau / decline, but was it similar last year to where we were seeing that and then Thanksgiving made it spike? Or I'm just trying to see how Thanksgiving influenced it last year to compare it to this year.
Yeah, that's a great question. And I actually am going to pull back up. If you give me 1 second. I'm going to pull back up our surveillance report because I want to show you of our epi curve. All right. So let me share a screen again. Sorry about that. Moving parts here. Okay, so can you all see the surveillance report again?
Mm-hmm.
Okay, perfect. So Thanksgiving, it's right around this time of year, or right around, here as in terms of where we were last year in terms of our epi curve. So we were just starting to really start climbing with a high number of cases. And as you can see, we had a significant number of cases in this particular week. And so, where we are here versus where we are down here, back here in November, it's definitely, we are seeing, a fair amount of cases still. Now, whether or not we're going to see the same precipitous increase after Thanksgiving or during these holidays is yet to be known. And what I mean that is it's going to really depend on a lot of individual factors, whether or not individuals are staying home when they're sick, if they've received their vaccines, if they've received a booster dose, if they're eligible. A lot will really depend on if there is going to be an additional climb like we saw last time, the same, around this point last year. I hope I answered your question.
Yeah, but I do have a second question for you real quick.
Please.
With the decline, kind of just looking at the charts with cases, since it's declining, how come we're still in high transmission and that's not improving as well as with the cases?
Yeah, so I want to caution that we are seeing, I would call it more of a plateau. We are seeing steps down decreases, but I would consider this more of a plateau, not a decline at this point in time. That's going to be something we'll have to look at as we move into the next couple of weeks. But in terms of transmission, the community transmission levels, they have also been ticking down because it is, the number of cases over a 7-day rolling average. So a couple of weeks ago, I shared that, we were 4 times. This week, we're around 3 times. So we are seeing a decline in that number of cases per 100,000, but we're still 3 times higher than that 100 per 100,000 set by the CDC, because we still have a lot of active disease in our community.
Gotcha. Thanks, Lori.
You bet. Thank you for your questions.
Hi, this is Emma Wulfhorst with NBC Montana.
Hi,
I
Emma.
had a question. I think this is probably more for Kallie, but thanks for the announcement regarding that healthcare worker vaccine requirement. I missed, and I just wanted to confirm, what did you say was the percentage of your staff at Bozeman Health that had already been vaccinated for COVID-19?
Yeah, so that's a good question, Emma. of those that have disclosed their vaccination status to us, we know that 80% of those who have already disclosed, about 80% of our employees. So just keep in mind there may be more, but they haven't disclosed that to us yet.
Absolutely. And then I know you mentioned this a little bit already, but kind of two-parter here. Going forward, just confirming Bozeman Health is going to watch the situation and kind of follow what happens and keep this requirement in place until you hear further.
Absolutely, yeah. And I should have shared a little bit also that 90% of our medical staff providers are have disclosed that they're vaccinated too. So we have our staff and our medical providers separated in those percentages. But yes, we will absolutely comply with the Medicare condition of participation, and we will just continue to follow what happens with regards to House Bill 702 and all of the other types of things that are going on with this CMS rule. So we will follow it as is until there is further direction from the courts.
Great. And then, sorry, the last thing, and if you may not be able to answer this, but do you anticipate receiving a lot of those medical exemption requests now that this, is going to be in place going forward? Is that something that you've heard that you expect to see a couple of those, or do you think it may not be that many?
Yeah, we have put out information on how our staff can seek medical exemptions as well as religious exemptions. So we have given them the tools for them to seek those types of exemptions. And I have heard from some of our primary care physicians that there are individuals reaching out to them asking to get that medical exemption. I don't have counts, but I do know that it's already happening because we have shared the tools and the guidance with our staff on how to seek those exemptions.
Perfect. Thank you so much.
Hi, sorry. I just wanted to ask a follow-up question related to the same topic. I'm Maya Goldman. I'm a reporter with Modern Healthcare. Thanks for inviting me to the briefing today. Is there, the OSHA mandate has been stayed and OSHA is not enforcing it at the moment. So if something like that were to happen with the CMS mandate, are you planning for that right now? Is there like contingency planning going on? And what does that look like if so?
Yeah, that's also a good question. We're closely following everything that's coming to us from CMS right now with our position on being a deemed CMS organization and to really be right in alignment with our mission to serve this community. We are going to follow that mandate until we hear anything further. So we are putting everything in place to assure that we reach those milestones. And if something should change, we've grown very accustomed in the last 2 years to pivot. We know that we have to remain very, very flexible, and we are continuously monitoring everything that's coming out to help inform any sort of contingency plans. But at this point in time, we don't have any other tracks in place except to comply with the CMS condition of participation.
Thanks so much.
Sam, you had your hand raised. Do you want to go ahead?
Sure, thank you. Yeah, this is Sam Wilson with Helena IR. I think actually my question was mostly just answered there. I just kind of wanted to clarify that, yeah, so the CMS rule is still in place, but it's currently subject to court challenges like the OSHA rule. I guess this is a question for Kallie probably. And I guess just to be clear, do you expect that you'll still continue to have that requirement in place if the CMS rule is placed on hold, similar to the way the OSHA rule was yesterday?
Yeah, that's a good question. And I would probably defer to our internal and external legal counsel to see how that would interact with state laws.
Gotcha. And the other question I had was just regarding booster shots now that they're kind of open up to all adults. Are you seeing slots filling up for that, or do you still have a lot of openings? I'm just kind of curious to kind of get a picture of what the demand looks like.
Yeah, Lori, do you know more of that answer?
Yeah, so thank you. As of right now, what we're seeing in the media, and maybe something has changed since then, so bear with me, but we have seen that the FDA has expanded eligibility, and the ACIP would still need to discuss that as well. And we can pop that FDA news release into the chat as well, so you guys all have that for context based on how we're interpreting the next steps here. But what I will say is that we will continue to have vaccine clinics in partnership with Bozeman Health. We are opening up more clinic opportunities as of today, moving into other parts of December. And we're not seeing any shortage of vaccine. So we're hoping that individuals, once that final approval has moved through and down to us, that we'll have plenty of availability for individuals who are seeking that booster at the existing clinics, as well as continuing to get it through your primary care provider or your pharmacy as well.
Great, thank you.
Yeah, thank you, Sam. Thanks, Holly. It looks like she popped that into the chat as well. It's a lot of moving parts, and it usually moves really, really quickly. So we're going to continue to keep our eye on that.
Lori, can I ask you a kind of a clarifying question going from that?
Sure, I'll try and answer it the best I can.
So just to clarify, the health department's current vaccine clinics are not offering the booster shot?
They are offering the booster shots in accordance to the previously established criteria for Moderna, Pfizer, Johnson & Johnson. So we have been in collaboration with Bozeman Health administering those booster doses, within those specified criteria. What decision is in the works, probably as we speak, is related to expanding that eligibility, or basically expanding that from 18 and all adults. So just kind of clarifying and removing some of those other criteria that were previously within that authorization. Does that help answer that, Andy, and clarify a little bit more?
Yep, perfectly.
Yeah, so we definitely have been administering, boosters out of the combined clinic with Bozeman Health for a number of weeks now. Good question. Thanks for the clarification. All right, other folks out there who have questions for us? All right, well, with that, I will say thank you so much for joining us today. I hope everyone who's joining us has a safe and happy Thanksgiving. Stay safe, wash your hands, stay home if you're sick, get a vaccine, get your flu vaccine, and we'll see you guys all in the next week or so. All right, take care. Bye-bye.
Thank you.
Lori.